Namaskar. We were talking about some small sutras which are useful to us in our daily practice and throughout our practice. So one of the sutra I discussed was Vatadayaha prakupyanti shirasi asrancha dushyati tata shirasi jayante rogaha vividha lakshanaha. That was common to, rather it was applicable to both diagnostic level and the therapeutic level. Now I am giving one sutra that is totally related to therapeutic level. That sutra is Shunthyama vatam shamayet Guduchi. The literally means is Guduchi, Shunthya sahita Amavatam shamayet. The point to be discussed here is shamayet. So this is shamana chikitsa. Now, since this is Bhava Prakasha Sutra, it is apta for us. So of course we don't challenge the authenticity. That is, we are not going to test whether it is efficacy, it has a efficacy or not. We believe. Since the text has written it, yes, we believe it. Now, the point of uha, that is the point of discussion, is what should be the dose and what should be the kal. That is, matra kalashraya yukti siddhir yukto pratishtita. Yuktishe yojana yatu yujjate. That is first thing. And inside that, what comes is, what is yukti? Matra kalashraya yukti. So, we believe it and we have to uha, that is, we have to discuss, we have to optimize the dose, matra and kal, provided we have confirmed diagnosis of amavat. Provided we have confirmed diagnosis of amavat. That is, you have to rule out sthitavat, gatavat, ashya pavarshakasha gati, or maybe vatarakta or simple vata prakop, whatever, and you have to confirm at primary level that this is amavat. And so when you confirm that this is amavat, you can go for this primary level intervention. You can call it as entry point intervention. When the patient comes to you for the first time, this could be your primary or first phase intervention for 7 days at least, and then you can decide the avastha or whatever. And I am not talking about classical avastha, but it depends. Though it may or may not be indicated some shodhana, the patient may need some shodhana also. But at basic, I am talking about the basic entry point intervention to amavat is Shunthi and Guduchi. The basic entry point intervention for amavat could be Shunthi and Guduchi. Now, you can use Kwath, you can use Churna. That depends on your clinical expertise and need of the patient. But my experience, I am just sharing my experience, and that is for Disha Naya Chapi Swayamuvita Buddhinam. Every patient is different, your geographical conditions may be different, and so your patient has to be different from my patient. Hitu may be different, the Rupa may be different, upashay, anupashay may be different. But still what I am telling is this is absolute primary level first phase intervention. That is, you start this as 0-point intervention. And then you can opt for, you may go for Samir Panna, or you may go for some, if classically not indicated, but the avastha is that you may go for some basti or whatever. But the first level intervention should be Shunthi and Guduchi. You can opt for Kwath or Ghanasar if you have, or Churna. Kwatha Matra as directed by the Grantha. Ghanasar, where it depends on you. But about half gram of Ghanasar per day of the mixture, that is per day I am talking about. Ghanasar if you have Shunthi Ghanasar and Shunthi and Guduchi Ghanasar, you can mix it. And what I am talking, or rather what I do is, that is half a gram of both the Guduchi and Shunthi Ghanasar. When I use Churna, the dose goes up to 3 grams per day. Varied dose, different kal, maybe early morning Rasayan kal, or maybe before lunch, before dinner Apan kal, or as the patient needs, whatever. But my dose is nearly 1 gram into 3, or in the rare cases I have given 3 grams a dose in Rasayan powders. The 3 grams dose includes 1.5 grams of Guduchi and 1.5 grams of Shunthi. So this is entry point. Now how you can add some values? Yes, you can give the bhavana of the same Kwath and you can reduce the dose. You can mix Kajjali into that and reduce the dose. That depends on your study, demand, and of course creativity. What we call Uhatantra Yukti. So you have different things to do. What I am projecting is absolute primary level intervention. And the sky is limit. Try to touch your limit. Thank you.